already by the time I decided to take the job, I had already had the opportunity to interact with staff both through these meditation sessions I would run, and then I would always make sure that there was time for conversation and kind of group debriefing about what we just did and how is this applicable, and the amount of sharing. At first everybody's like body language was all tight, and but over time people really opened up to me, and I just saw how visceral the the experience for both populations, uniform staff and people in custody was. And I think my immediate concern was really like providing help, support, bringing light or compassion or a heart into this very difficult environment. And so it was more about how much could I take on, because with hospice, like I was working in home hospice, and there were several times, it would happen every month where I might have 3 patients in different parts of the city dying at the same time.
Oh, wow.
And then finding myself kind of in this moral dilemma. The nurse managers for each calling and like,
Yeah,
gotta go over there, gotta go over there. And I
yeah.
like, if I could split into 3 people, that would be wonderful. But now I need to make this really hard decision. Who do I go to first? Who do I follow up with? Probably after their loved one, who I became very close with,
Right.
passed away. So stepping into, so I was comfortable with being in these really kind of hard situations, but the I guess it was also just being in relationship to violence too, and it's just a different kind of flavor, especially with respect to chaplaincy, um, and and yet at the same time, I do profoundly feel that we as people have power in relationship to be able to just help shift an environment, help shift what somebody's going through at any given time, and to be involved in that, for New York City Department of Correction just felt like the right thing to do.
Yeah. And I guess there's also the question that, regardless of whether and how you're pushing for institutional change, that's not going to happen overnight. And there are still these systems in place and these people working within them that do need care. And how can we address sort of the immediate need that is showing up in front of us in that moment?
Yeah, absolutely. And so it's a little similar, like with hospice, with somebody who's declining. The big picture problem is death, right? Or impermanence, if you're coming at it from a Buddhist perspective. And then the small picture is how I'm feeling in the moment, how the person is feeling in the moment, right? So I can't do anything to change, that someone is approaching the end of life, but I can help them perhaps cope a little bit better with the anxiety they might be feeling, or the fear, or meaning making. Gosh, like here I am now, like, and I look back and I see my whole life, and this is how I'm feeling.
Yeah.
And it's very similar, I think, not just in corrections, but from what I know from friends who are chaplains for FDNY or NYPD, is that the big big picture issues we can't necessarily change easily, or we may never have the power to do that, but we can make huge change with respect to how people view themselves in these hard situations, how they relate to the stress or anxiety or trauma that they might be going through, to make it more livable, to make it tolerable, to make it actually a place where there's room to thrive, as opposed to just again, going back to the very beginning, this idea of just the binary label being put
Yeah.
on these places where it's just bad.
And what is there, What do you think you would like to sort of share with people who might be living, in understanding that's rooted in those binary labels? Like we might be aware that there are people who are working in the Department of Corrections are witnessing violence, but are there other sort of harms or stressors or sort of just things you think it would be helpful for us to be aware of to move out of that kind of bifurcated thinking into something that might be more healing?
Yeah, I mean, I think the primary thing is understanding that the people who work in corrections are people just like us, and it's very easy to kind of otherize people who work in environments, and and therefore kind of become symbols of things we would like to change. It's almost as if the humanity ends up being removed just by kind of projected association. Well, like jail's bad. Everybody who works in jail is it wants to harm people. And I mean, I could definitely, like, I've not only have I witnessed the most tender moments, but between correctional staff, I've made incredible friendships, and the beauty that arises in the midst of the intensity of that environment is as beautiful as human relationships anywhere else can be. I think that, I mean, the big problem that I see now, just across the board, is there seems to be less flexibility within these kind of discursive poles of good or bad, or I mean, we see this in the election that's happening right, the electioneering that's happening right now. There only seem to be two options, and but if everybody is just yelling, everybody's reacting. And with respect to criminal justice, I'm all for somehow getting to the initial kind of definition of justice that I described in the beginning of this conversation, and that's where my heart is. And to for a city like New York City to run and function, and for there to be a sense of safety and justice, there's so many complex factors that we need to address outside of corrections, like for example food access,
Yeah.
substance abuse problems, healthcare, mental health, and access to education, access to training, examinations around intergenerational trauma, around systemic racism. And these are, these, in order to do that, everybody in a given society needs to participate.
Right.
It's not that you can just close buildings and have these problems go away.